You wake up with a headache that won't quit. Your first move is the medicine cabinet. Now picture someone 7,000 years ago, gripped by the same pain, reaching instead for a sharpened flint blade pressed against their own skull. Sound primitive? It often worked. Long before antibiotics, before anesthesia, before anyone understood what a bacterium even was, ancient humans were performing real surgery on the human brain. And in many cases, the patient survived. This wasn't guesswork. This was medicine. Not the polished, sterile version you picture in a hospital. A rougher, older version, built one painful lesson at a time. And for most of human history, it was the only medicine there was. No prescriptions, no painkillers. Just whatever the body, the land, and thousands of years of trial and error could offer. So what did that medicine actually look like? Stranger than you'd think. And in more cases than you'd expect, eerily close to what's sitting in your own medicine cabinet right now. The procedure is called trepanation, and the idea is simple, even if the execution sounds brutal. You scrape or drill a hole into the skull, usually to relieve pressure from a head injury, treat seizures, or release what people at the time believed were trapped evil spirits. The earliest confirmed example dates back over 10,000 years. But the real surprise isn't that people tried it once. It's that the practice shows up again and again on nearly every continent, invented independently by cultures that never met. France, Peru, China, the Pacific Islands, different people, different centuries, the same desperate solution to the same problem. Archaeologist John Verano spent decades studying trepanned skulls from Peru, where the practice was especially common among ancient Andean cultures. He examined hundreds of skulls and found something remarkable: smooth, healed bone around the openings. That smoothing only happens if the patient lived for months or years afterward. In some later Andean periods, survival rates climbed above 80%. For comparison, battlefield skull surgery during the American Civil War, thousands of years later, killed roughly half the people who underwent it. Somehow, with stone tools and no germ theory, ancient surgeons in Peru were outperforming surgeons with steel instruments. How? Not luck. Through something just as valuable as any modern drug: pattern recognition, passed down and refined over countless generations. Verano's research even shows a clear timeline of improvement. Older skulls from earlier centuries show rougher technique and lower survival. Skulls from later centuries show cleaner cuts, smaller openings, and far higher survival. Someone, somewhere, was paying close attention. Someone was learning from every patient who didn't make it and adjusting the next attempt accordingly. This wasn't only passed down through demonstration. Around 400 BCE, the Greek physician Hippocrates wrote detailed instructions for trepanation in a text called On Injuries of the Head, describing exactly how deep to cut, which tools to use, and which mistakes to avoid. That means the knowledge had become precise enough and valuable enough to be written down and taught formally, centuries before anyone understood what a brain actually did, let alone how it worked. Surgery wasn't the only place this skill showed up. It showed up in something far smaller, hiding in fossilized plaque on ancient teeth. In 2012, researcher Karen Hardy and her team analyzed the hardened dental plaque, called dental calculus, on Neanderthal remains found at El Sidrón Cave in Spain. Buried in that plaque were chemical traces of yarrow and chamomile. Both plants are bitter. Both are essentially useless as food. But both have long been used to ease inflammation and digestive pain. Why would a Neanderthal eat something with zero nutritional value and an unpleasant taste? The most likely answer is that they weren't eating for hunger. They were self-medicating. And the evidence doesn't stop with Neanderthals. In 1991, two hikers in the Alps stumbled on a body preserved in ice for over 5,000 years. Researchers named him Otzi. Tucked into his belongings were two small, leathery lumps. For years, nobody knew what they were for. Eventually, scientists led by researcher Albert Zink identified them as birch polypore, a fungus known to carry natural antibacterial and antiparasitic properties, meaning it fights bacteria and intestinal parasites. Otzi, it turned out, had whipworm eggs in his intestines. He wasn't carrying random forest debris, he was carrying his medicine cabinet, and it wasn't just plants and fungus. Ancient Egyptian physicians, writing in a medical text known as the Ebers Papyrus around 1500 BCE, prescribed honey for open wounds, layering it directly onto cuts and burns. For thousands of years, that looked like superstition dressed up as treatment. Then modern microbiologists actually tested it. Honey, it turns out, has almost no water content, which starves bacteria of the moisture they need to multiply. And it slowly produces hydrogen peroxide, a natural antiseptic. Egyptian physicians didn't know any of that chemistry. They just knew that wounds packed in honey healed, and wounds left open often didn't, so they kept doing it. So picture it. Picture a small camp at dusk, smoke curling up from a low fire. Someone returns limping, a gash across their leg, already swelling. An older woman crouches beside them, presses a paste of crushed yarrow into the wound, and wraps it in leaves soaked with something sweet and thick. She has done this before. She watched someone do it for her, years earlier, after her own injury. A child sits nearby, watching closely, memorizing the order of movements without realizing that's what they're doing. There is no diploma here, no textbook, no clinic down the road. Just thousands of accumulated trials, thousands of small failures and successes, distilled into a single confident motion of the hand. How many generations did it take to get that confidence? Nobody counted. It simply accumulated, one healed wound at a time. That's the part most people get wrong about ancient medicine. We picture flailing superstition, random chance, blind guessing, desperation dressed up as ritual. But here's the twist. Much of it was closer to controlled experimentation than we ever gave it credit for. Generation after generation tested what worked on real people, with real consequences for getting it wrong. The treatments that failed were forgotten, sometimes along with the person who tried them. The ones that worked were repeated, refined, and passed down the line, parent to child, healer to apprentice. That is, in its rawest form, the scientific method, running for thousands of years before it ever had a name or a laboratory to call home. Think about what that means. Every single plant your ancestors decided was safe to eat, safe to apply, safe to brew into a tea, was tested first on a real body with no guarantee of survival. The knowledge wasn't handed down from nowhere. It was paid for, slowly, in trial and error across thousands of years. And it didn't disappear. It just got rebranded. Hospitals today still use maggot debridement therapy, deliberately placing sterile fly larvae into wounds because the larvae eat dead tissue and leave healthy tissue alone, speeding up healing in cases where standard treatment has stalled. Leeches are still used in modern reconstructive surgery to restore blood flow after certain operations. Willow bark, chewed by ancient peoples across multiple continents to dull pain, contains a compound that chemists eventually isolated and refined into aspirin. Even penicillin, the drug that launched modern antibiotics, comes from the same family of mold-based compounds that ancient cultures were already experimenting with when they packed wounds in moldy bread. And it goes further than wound care. Indigenous communities in South America had long known that chewing the bark of the cinchona tree could ease the violent fevers of malaria. European scientists eventually isolated the active compound and called it quinine. For centuries afterward, it was the only effective malaria treatment on Earth, built entirely on knowledge that existed long before anyone could explain why it worked. The lab didn't discover the cure. It only explained one that was already sitting in someone's hands. None of this means ancient medicine was always safe or always right. People died from infections, from blood loss, from treatments we'd now consider dangerous or outright wrong. Bloodletting persisted for centuries, despite doing far more harm than good. Plenty of remedies were pure superstition with no real effect at all. But underneath the failures sat a sound instinct, the same one driving every breakthrough since. Observe, test, remember, repeat. That instinct is the same one sitting inside every modern clinical trial, every peer-reviewed study, every pharmacist's shelf. So the next time a headache sends you reaching for a pill, remember the version of you that lived 7,000 years ago. They didn't have your pharmacy. They didn't have your lab results or your insurance card. But they had something just as powerful, generations of trial and error, etched into memory, ready to be pressed against the wound.